Hi, everyone. Welcome to the National Spine Health Foundation. I'm Erica Anderson, and I'm joined today by Dr. Colin Haines. He is a spine surgeon and the director of research at the Virginia Spine Institute, one of the Spine Health Foundation's centers of excellence. Dr. Haines, thank you so much for joining us today.
Thank you for having me. I'm very excited.
Yeah, well, the theme we've chosen to focus on this month is about disc herniation. And we know that you're a leading expert in this field, but that you also know firsthand what it's like to experience a disc herniation. So I would love to just start off by having you tell us, what is your experience with this? And then what led you to pursue this line of work in your life?
So one of the exciting parts about my job is that 90% of people who see me with back problems, including disc herniations, become totally pain-free without ever needing surgery. And as you mentioned, I'm one of them. When I was in high school, I was playing soccer. I thought I was invincible, and I didn't warm up properly. I took an awkward twist and awkward fall during the cold autumn weather, and I herniated disc. And what a herniated disc really means is that you can think of the discs themselves are the shock absorbers of the spine. And a herniated disc is almost like someone stepping on a jelly donut. The jelly from the inside squirts out, can press on a nerve, and can cause radiating leg pain, what people call sciatica, or can cause deep down back pain, or both. Well, I had them both. Fortunately, most people get better without needing surgery through a combination of physical therapy, structured exercise programs, anti-inflammatory medications, and sometimes injections. Well, this was a very powerful experience for me because, as you mentioned, it really propelled my enthusiasm and my life's mission to help people with spinal problems, and also allows me to empathize with patients who have spinal problems. Boy, I still remember to this day how much it affected me, how I couldn't walk, how I couldn't stand, how I certainly couldn't get back to playing soccer right away.
And so what are, some of the things people don't know are how are these caused? I mean, there's a variety of reasons that people get a disc herniation. What are some of those reasons, and can it be avoided? Is there anything we can do to prevent that from happening?
I'd like to say that good overall health is good spine health. Now, it doesn't mean by having the world's strongest, most supple core that completely eliminates the risk of having a disc herniation. But in general, the stronger our core is, the more mobile our core is, the healthier diet we have, the fact that if we're able to avoiding tobacco and nicotine products, those are things that can minimize the risk. Now, when people have disc herniations, they tend to come in two varieties. Sometimes someone in a car accident, a professional football player gets tackled, someone with a bad fall, or other times it's people just waking up after a tough night's sleep. And that latter camp, it tends to be this multiple small injuries that build up with time, as opposed to one big catastrophic injury.
And what do you think is sort of, I'm a person that suffered from this myself. I've actually had back surgery on, herniated disc. And, what are some of the things that you see people doing wrong as they're sort of trying to deal with this? Because I know surgery isn't necessarily the first option, but sometimes people get freaked out. And so when someone gets a diagnosis like this, what's the first thing that they should be doing?
The most important, you hit it right nail on the head, is getting the adequate diagnosis. There's a lot of fear, there's a lot of anxiety, and there's a lot of misperception that just because you're seeing a spinal surgeon means you're getting spine surgery. Well, it couldn't be further from the case. And what I think is so important is that if you've got a back problem, if you're having radiating leg symptoms, see your spinal surgeon for that adequate, that spot-on diagnosis. Because if we don't know how to get things better. Now, when we're talking about improving things, and again, almost always it starts non-surgically, there are a lot of things we can do. Physical therapy, modifying the body's mechanics, and improving that core is really the best first step to do. Now, that doesn't mean you have to bench press your body weight. It's a combination of having a strong core as well as a mobile core. Well, the next layer is dietary modifications. We do see that diet has tremendous impact on the body's overall levels of inflammation, as well as the body's overall level and ability to heal. Those are two of the things I start off right off.
Curious about the dietary aspect. Can you give any direction in terms of what are some of those anti-inflammatory foods we should be eating?
So in general, eating more plant-based and more natural food is optimal. We want to try to stay away from the highly processed, highly sugary foods, ones with lots of nitrates, foods that just aren't natural. Those are the ones we tend to that we should try to avoid, because we know that the more sugar, the more processed ingredients that food has, the higher level of inflammation that it brings.
So I know one of the biggest questions that people have, I know the question I had was, how long until I can get back to my stuff? Like, I'm a runner. A lot of people are athletes that deal with back problems, and they're always wanting to know, how long is it going to be? So can you talk about sort of the time from, the time span that people have to go through to get back to normal?
So in general, 90% of disc herniation gets hit better in the first 3 months or so. So it's reasonable to expect getting back to that full level of functionality relatively quickly. Again, there are many different non-surgical tips and tricks that we can do to help you along that process to amplify the healing process. But in general, if it's a disc herniation, that's a more routine, common type of disc herniation. It's your spine's not like it has a fracture. It's structurally stable. So when you're feeling up to it, you can actually get back to it. Now, if someone needs surgery, I tend to hold off on those activities for about a month. And the reason being, after disc herniates, it's almost as if the outside layer opens up and there's still this persistent defect, this persistent opening. So that scars in with time, but it typically takes about 4 weeks to a month for that to scar in. So after surgery, I take things nice and easy, have patients pretty much just walk and do their physical therapy for that first month.
So I know I hear from people that they are just terrified of surgery. They will do anything to avoid it. So at what point in this journey would you say someone really needs to consider that? And also, I know that there's probably fear out there that's unfounded. So talk a little bit about that.
Couldn't agree more. There is a lot of fear about spine surgery, and a lot of myths about spine surgery. The reality is how we do things today compared to how we did things even 10 years ago couldn't be further, couldn't be more divergent. It's because we're just much better than we used to be. Again, part of it comes from the fact that most of the time people don't need surgery. Now, things that might lead us down a surgical path, if there's signs of nerve damage, if someone has bad weakness in the legs, if they're having issues with their bladder or their bowels or severe numbness, things that are telling us that there may be progressive or even permanent nerve damage, those are situations, and those are people where we start talking about fixing things and taking the pressure off the nerve by removing that disc fragment sooner rather than later. One of the biggest things that I see day in and day out is really talking about functionality. What I mean by that is, aside from having those big, bad, scary nerve symptoms, if someone's not functional, if someone's not enjoying their life, if someone's not, as you mentioned, running, or if someone's not holding their grandchild or their child because their back's bothering them, that's when I start also considering trying to modify things and considering surgery. It's more than just pain. It's really functionality and be able to enjoy the life that people want to live, not have their back limited.
Yeah, absolutely. Well, here at the Spine Health Foundation that we really exist to offer hope and just empower people with knowledge and education. So just on that note, what would you say to someone that's listening that maybe is in a lot of pain or has just recently gotten a diagnosis? Like, what sort of hope would you offer to them as a person that's working with people recovering every day?
Well, I think that word you said is so critical, is hope. So often I see people, they come in and they don't think that they can ever lift their child again, their infant again, or they don't think they can get back to running that marathon. Well, when people are treated properly, whether it's non-surgical treatment, again, which most people are able to get better with, or whether it's surgical treatment, boy, people get back to life. And that's really the biggest thing, is that it's not about pain. Pain is important, but it's really functionality. For me, that ties everything in. It means that your people are out of pain, be able to take it to that next level, being able to do whatever they want to do and not have their back dominate their lives. And that's what I expect with every single patient I see.
Yeah, and I think what's been so encouraging working with the Spine Health Foundation and seeing the work that you and other doctors that we work with are doing is just that there's just so many new things on the horizon, so many different new treatments and technologies. And I think that's something that people can really look forward to and just put their hope in, just because things aren't like they used to be. And it's just kind of like a whole new world in spine health these days. So Dr. Haines, thank you so much for taking the time out of your very busy schedule to join us today. Just give us a little bit more education on disc herniation.
Absolutely. Thank you for having me. Thank you for all you do as well.
Thank you.